Arterial Disease.
Whoa, PAD, what is that?
So it's kind of like a heart attack of your legs, and we brought in an expert, Dr. Bev Chan, vascular surgeon, to tell us all about it today.
We're like carpenters, you're like a plumber, and you're going to tell us about
That's
the
right.
pipes in our legs right now. Thank
Yeah.
you so much.
Oh, you're welcome.
Okay, so peripheral arterial disease. What is it, Dr. Shannon, and who gets it? Let's start at the beginning.
So what it is, it's plaque buildup
Yep.
in the arteries. So there's lack of poor blood flow to different organs, so
Okay.
like the muscles in your legs.
Okay,
Okay, so you have arteries in your legs that carry the blood to your legs or other organs, and when you have plaque build up, the diameter of that artery gets smaller and smaller because the plaque's building up in the artery, so you can't push as much blood.
it's funny. I feel like arterial disease is one of the few diseases where we talk very specifically about every body part. You got like neck artery disease, you got like heart artery disease, you got leg artery, but really, it's just the same disease. And if you have one, unfortunately, you probably have all of them to some degree. We talk about them very differently. But some of the causes are the same, some of the treatments are kind of the same, and then the outcomes obviously are what are different.
Yes.
Okay, so who gets this, Beth?
So smokers.
Number one, smokers. We've talked about this 100 times on our videos. It is a known risk factor for so many negative health effects. Unfortunately, it's very difficult to stop. Please try to stop smoking.
Don't start.
Don't start, even better.
People with high blood pressure.
Okay?
Hypertension we have talked about in our videos
Yes,
before too.
very, very
Hypertension.
common. Lots of people have high blood pressure.
Asymptomatic condition, but has a lot of diseases that it can cause.
Yeah. If they have high cholesterol.
Right. Haters, please do not leave angry comments about the role of cholesterol in plaque formation in your vessels. It is real, and it is the specific cause of this problem with a host of other reasons. But ultimately, this is the real cause. That's what causes the blockage. The inflammation, the irritation of that plaque, the calcification, and the reduced flexibility of those vessels.
Yes.
Okay, anything else?
Diabetes.
Yeah, diabetes, such a difficult condition. Okay, what about genetics? Is there any?
Genetics.
Family
Okay, there is a genetic predisposition.
Yeah. And aging.
And
You can't really help that.
That's
Stop
not your fault.
aging right now. If you're
Okay.
aging, any one of our viewers, if you're aging, stop. Well, no, don't stop. If you stop aging, it
No.
means you died.
That's right. So there's a host of
can't
things
help
that
that.
host of things that cause it. What does it look like when it comes to you in the office? What are people complaining of? They're not saying, "Hey, my leg does not have adequate blood supply."
No. So they complain about what we call claudication.
Okay.
So it's when you're walking a certain distance and then they get pain in their legs. So it could be like the buttock,
Yep.
the thigh, or the calf muscles. And it's usually at a specific distance where they're like, it hurts.
Okay.
And then it's relieved with rest.
Okay, so very specifically, exercise-induced cramping in your lower body that is reduced by rest. So then once it stops, they start walking again, and then after that same approximate distance, the symptoms come back. And then
Yeah.
they sit, and then it
Yeah.
goes away.
Yeah.
Okay.
And your muscles start to cramp and hurt because they're not getting enough blood supply.
Yeah. It's what we call, like a lot of people would be like, oh, it's like lactic acid built up in their muscles.
Right.
Yes.
Yeah, you feel that if you're working out
Yeah.
and all the rest of it. It's
Yeah.
the same thing, but you're getting it just from walking instead of
Yeah.
lifting heavy weights.
Exactly.
And the location of the pain relates to the area of the blockage. So that buttock pain you get from vessels, even your iliac arteries way high up,
Yes.
down to your popliteal artery down below
Yes.
your calf. Okay. Most commonly, is it in our calves and our feet more
Yeah.
than our thighs and our
more in the
buttock?
calf. Yeah.
Okay. Is another symptom people that say that they have pain when they're lying down at night, which is ironic. If you get it when you're lying down, like that non-dependent kind of pain.
Yeah. If they're lying down and it's pain because of peripheral arterial
serious.
disease, it's bad. And it's usually in the foot.
Okay.
And they have to dangle their feet over the side of the bed
Right.
to feel better.
And that's just a sign of more advanced disease.
Yeah.
Okay.
And that you have to be careful because that can be, if you're experiencing these symptoms, those can be confused with neurogenic claudication, where you're having those kind of cramping and muscle pains because of a nerve problem.
Yeah.
You've got the carpenters, the plumbers, but the electricians, the neurologists, the neurosurgeons, those are the ones that are concerned with neurogenic claudication, which can also give you similar symptoms, just not relieved as quickly when you rest when you're walking.
Okay, so someone comes to you with the classic story. They've been referred to you by their family
Right.
doctor. When you do a physical examination, is there something specific that you're looking for that says, yep, this just confirms the story?
So I'm looking to see if they've got like gangrene in their toes.
Okay, so
That's kind of like worst case.
okay, so we're gonna talk. So what is gangrene, Dr. Chan? That sounds scary.
It's dead tissue.
So
Okay.
dead tissue.
All right, sure. I mean, that's the extreme end of peripheral arterial disease.
That's
Right.
worst case.
That's worst case. So you have like black, potentially It's going to be
Yes.
the end of it. It's going to be terminal. So it's going to be like your digits, like your toes or,
Yeah.
or your
Yeah.
foot is actually black, and that's called
Yeah.
gangrene. There's sometimes
Yeah.
they're wet and dry forms. We don't have to get into that.
Yeah.
So that's the
Yeah.
advanced disease. Are there any other physical signs that you're looking for?
So I'm looking to see if there's like muscle wasting too.
Okay. So muscles aren't getting enough blood
Yeah.
supply. They're going to get
Yeah,
smaller.
color of their legs.
Okay. When you
If
say
there's-
color,
So if I lift their legs up, they turn like blanch white.
Right.
If they're hanging down when I'm seeing them, they get like more like red and purpley.
is that the Berger test?
Yeah.
Yeah, the Berger test. And you lift it up, and then you determine the angle
Yeah.
because essentially the blood's going back
Yeah.
kind of to your core, and then your leg gets white.
Oh, I thought it was because you ate too many burgers. That's
Well,
why you
it
have
could be
that's why you have
related.
this disease.
But I think it's BER is the test, and
Right.
BUR is what caused the problem.
Okay, so these are some of the signs. We talked about the symptoms.
Yeah.
That's the claudication. The signs are the things the doctor sees when they examine
A couple
you.
other signs, I would say. What about the hair situation? Because they
Yeah.
say if you lost all the hair on your
Yeah.
legs, that could be a sign that it
For
doesn't have blood
sure.
supply. And then what about other open wounds? So maybe not gangrene. What about ulcers? Because a lot of people
Yeah.
have ulcers on their legs.
Ulcers can be from different reasons.
Right, so you
but
have- so not
one
sure.
of them is peripheral arterial
Okay.
disease.
All right.
Probably you can
Yeah.
get that from venous disease
100%.
as well. Okay, so we talked about the symptoms, we talked about the signs, we talked about who gets it, which in other words is the risk factors for it. How do we treat peripheral
Oh,
arterial disease?
Couple things. Are there any special tests that you can do to determine? So say you
Investigations.
don't have an ulcer and you don't have gangrene, but you're nervous about this and you think, yeah, this is a pretty good sign. Are there any ways to confirm or assess the severity of their disease?
Yeah, there's lots of different tests.
Okay.
There's
What
a
do you
simple
use?
one is an ankle brachial index.
Okay.
So that's where you measure the blood pressure difference between the ankle and the arm.
Right.
Right. And there's a number that you care about?
Yeah. So 0.9 to 1.4 is normal.
Okay.
Anything below that is not.
It's not normal.
So
Okay. And
the
then
blood
lower
pressure
shows.
in your legs is lower than the blood pressure in your arm. That's what you're saying, and that's
Yeah.
5.9%, right?
Okay.
Because you've got peripheral vascular disease preferentially in your legs as opposed to your arm.
Okay. Any role for X-ray, for ultrasound, for CT scan, MRI, anything like that? Angiogram.
Ultrasound is great.
Okay.
Because that's non-invasive and
Yeah.
it's not damaging to the kidneys. So
Okay.
I like that. CT scan with IV contrast dye is good.
Yep.
Sometimes MR angiogram as well.
Right.
Angiograms are great too, but they're more invasive, so that's usually coupled with treatment at the same time.
Almost like surgical planning.
Yeah.
Okay. So last resort. Okay.
So an angiogram is basically where we inject a dye into your artery and look at it under a fluoroscopy machine to see where the
Yeah.
blood's going, to see if it's constricted and where it's constricted.
But
And-
CT scans are so good now with because you can get a CT angiogram.
A CT
all at
and with a
once.
dye?
Yeah.
Okay. So you still need some kind of dye, but
Yeah.
at least you don't need to look at it under an X-ray machine. It goes into a CT machine.
Yeah.
Is it done live too while you're doing it? Or you
Um,
inject?
For the CT
Yeah,
angiogram,
yeah.
It's
Okay.
like when you order a CT.
Okay. So still a little bit invasive, but an MRA is going to be your least invasive, right? MR angiogram, because you don't, are they still injecting gadolinium?
Yeah, yeah.
Oh, you're still getting
You know
Just
what?
no
CT
radiation.
angiograms
Just no
are the
radiation.
quickest,
Yeah.
and then
CT
they
and
are-
just
yeah.
fast. It's just less radiation, I guess.
Right.
Yeah.
Okay.
They're all pretty invasive except for your ultrasound.
Yeah.
There you go. So now you got your diagnosis. Okay, so the doc said, the patient comes to you and says, listen, I just don't want to lose my leg. Obviously, this is the concern for a lot of these patients, and unfortunately, this is a potential outcome.
Yeah.
What do you implement as far as the treatment, say in the early stages before they're at surgical consideration? Say you just want to deal with the symptoms. What can we do to help their symptoms?
So for claudicants, if
Yes.
they have very minimal symptoms, it's best to do everything but surgery.
Okay. Okay, so that
So-
sounds like some lifestyle modification and maybe
Lifestyle.
some medical treatment.
Yeah.
So what kind of lifestyle things can you do to reduce your claudication?
Quit smoking.
Okay, so
Okay.
number
Quit
one,
smoking.
obviously, good choice.
Change your family history.
Yeah.
Yes.
Can't do
Make
that.
them exercise.
Okay, and so
Exercise.
someone's telling you though, Dr. Chen, I can't exercise because it hurts my legs too much when I walk one block and it hurts.
You make them.
You make okay, so you make them. And so the thought behind that is that by exercising, you're going to build up your walking tolerance, your collateral circulation. So you're
Yes.
actually going to make new
Yes.
vessels to go past the block vessels.
Yes.
So if you go one block, we want you to go 20 more feet.
Right. So
and then
they're making their own bypass system.
right. So they're literally their
Yes.
bodies are making it.
Yeah.
Is that why
And-
you turn the elevators off in your building?
Yeah. You gotta take the stairs.
Right.
Right. And so
Makes
okay,
sense.
so someone says, okay, fine, Dr. Chan, I don't believe this is going to work, but I'm going to do it. How long would it typically take to see an improvement from a structured exercise program?
It takes a while.
I'm assuming it
Yeah,
would. Like
yeah.
a while, like months?
Months.
Yeah, like
Yeah.
2 months or like 9 months?
it's probably a bit more than that.
Yeah, okay, so
but
it's a long
even
time.
with like 2 to 3 months is pretty good.
And effectiveness rates on what kind of scale are we talking about for the mild claudicants? Like are we 50, 70,
good.
80%? It's a very
Yeah.
successful thing. So here's the thing, it's free
Lifestyle.
Yeah.
and it can reverse a potentially life-threatening condition.
And it's not grueling exercise we're talking about. We're talking about walking.
Walking.
Basically.
And quite opposite, right? So if you do
Yeah.
more grueling exercise, it's actually not good for this because you want that slow, chronic stress to make those new vessels. Yeah.
They can
Okay.
run too.
Okay. Oh, really? You can?
Well, some of them.
Okay.
And then they get into our office because their knees hurt. too
Yeah,
much to run
exactly.
on.
Okay.
Yeah, they always complain about
Cycle.
their knees
What about
to me.
cycling?
Cycling's
impact, low
good.
impact.
The recumbent bike or something.
yeah.
Okay, so you
Watching
quit
TV.
smoking, you've increased your exercise. What about diet? We talk a lot about trying to make healthy choices, not prescribing a specific diet, but what do you tell them about diet?
You want 5 servings of fruits and vegetables a day.
Okay, fruits and vegetables, reduce your trans fats, I'm assuming,
Yeah.
reduce your processed foods and your
Yes.
sugars. Like basic stuff that we talk about all the time. Eat real food, not a specific diet, but more fruits and vegetables, real food.
Okay, and now if you are living with diabetes, what can you do to help? Because that is a risk factor.
Yeah, control it.
Control your diabetes, right? That's your job now. You are in charge of your own health, and if you are living with diabetes, you are now in charge of your sugars. That can help your peripheral arterial disease.
Okay, what about medications?
There are so many medications.
Right. So we talked a little bit about the risk factors. So if you have high blood pressure, control your high blood pressure. If you have diabetes, control your
Yeah.
diabetes.
Yeah.
If you have high cholesterol,
Medication.
heaven forbid, people are going to get really angry. But
There's
if,
medications?
if you cannot modify your cholesterol with your diet, which is very difficult to do for a lot of people, you may require a medication, maybe even a statin. Sorry, people get really angry about statins on our channel, Bev.
There's
any
other stuff,
What about
too.
vasodilating medications? So people are like, well, what about nitric oxide? And what about medications that increase the amount of nitric oxide in my vessels? Is that a thing? Or not really?
It's not the standard.
Okay.
Yeah.
So what other medications are you talking about?
Blood pressure medications.
Yes.
Right. So that's standard. So
Yep.
I know guidelines show it's like the ACE inhibitors and
Yep.
the ARBs. So those are really important.
Okay.
Sometimes an antiplatelet agent.
Right. So
Like a
something like
baby aspirin.
clopidogrel, aspirin, Plavix.
Yeah.
Okay.
Okay, so, and you know what, we always, whenever we talk about medical treatment, we always talk about lifestyle first, and we did today.
Yeah.
Lifestyle modifications first. Sometimes, most of the time, often that works. Sometimes it doesn't, and you need to take medications.
Right. Okay. So you give them a trial of 3 months, 6 months with the meds.
Yeah.
Okay. And they come back and they're like, listen, my claudication is getting worse. I can't sleep at night. I can't walk a distance. I can't do my job. I can't spend time with my family or be with my wife or my kids or whatever. Now what?
Then there are different procedures.
Okay. So what are where do we start with the procedure? So you've done the testing to know the specific vessel that's blocked. How do we deal with that blockage?
So it depends on exactly where the blockage is.
Okay.
And
So-
that will determine what kind of treatment options there are for the patient.
Okay.
So whether it's like a more minimally invasive endovascular procedure
Okay,
versus an open procedure.
Okay, so let's start endovascular. So what do you mean by that? What does endovascular procedure mean?
So it's usually tiny punctures
Okay.
in their groins
Yep.
or in their wrists, and to snake wires through these areas where the blockages are,
Right?
get through them, and either put in a balloon to stretch out the vessel
Okay.
or a stent.
Okay.
There's some other treatment options too, like
So let's start there for
Okay.
a second. Yeah,
We learned this from
super cool.
The roto-rooter people are like, yeah, go
Right.
for that.
Yeah, yeah,
Same
it's
idea,
really
right? You're
nice.
just putting in something in the vessel, minimally invasive, to dilate or blow up that vessel a little bit to increase the diameter to let more blood flow go through.
Right, and the thought of the balloon is that it expands that plaque, and the purpose of a stent is that if you just expand it and then let it go, it might collapse again. So the stent holds it open.
it holds it open.
Okay. And do the stents typically have, do they elute drugs commonly for
Some
the
of
stent?
them,
Okay, depends
yeah.
on the
Yeah.
procedure and what your needs are. And does that work?
It's pretty good.
Okay.
Okay.
They
So-
last for a little bit, and then
Okay.
if there's other factors into play, like a lot of my patients continue to smoke, and then
Right.
it clots up.
Okay,
Okay.
so those may not last forever, but
Yeah.
they may give you many years of
Yes.
relief. But
Yes.
even if you have a surgical intervention, you can't do that instead of a lifestyle modification. That should be in conjunction with a lifestyle modification.
Okay.
And the
Yeah.
other things we talked about.
What about surgery? Can you go in? Why can't you just cut it out? Why
Like
can't
cut
you
out
cut the
the
plaque?
artery.
No,
Oh
the
yeah,
plaque.
you can.
Okay, so you can.
So we do.
Okay, does that work?
It's pretty good.
Okay.
So that's
And then
it.
we put like a patch over it to make the diameter a little bit bigger.
Okay, so you graft it.
Yeah.
Okay. And then if that doesn't work,
There's bypass.
Bypass, just like for your heart.
Yeah.
Where you say, we're not even going to address this plaque, really. We're just going to go around it.
Yes.
Okay.
And drop a new pipe around the block,
Yeah.
and hopefully that gets the
Yeah.
blood flow to the tissue.
And we
beyond.
want to use like their own veins typically.
Yeah, so it's a transplant of one of your veins from one
Yeah.
place to another.
Yeah.
Brilliant. But that's been around for a long time.
Yeah. It's good though.
Okay, boy,
Okay.
there's your
That's a-
treatment. And that,
that's a lot.
again, is in conjunction with the other stuff we talked about, the lifestyle and or the medications you need if you have hypertension or
I would assume that even after you've had the procedure, doing all that stuff is maybe even more important, right? Like all the
Yeah.
lifestyle stuff, all your
Oh,
medications, right?
completely.
You really need to change your life so that A, this works, and B, it doesn't progress in other parts of your body.
And you don't lose your leg.
Right. Okay,
Okay.
so I think
Right?
that's
Well,
a
that's
topic
that.
for another video. It's kind of that acute limb ischemia where you can have a life-threatening pathology to lead to limb loss and chronically as well, I guess.
Okay, and then not uncommon. I mean,
Not
you
uncommon,
this
we see it.
often. All right, there you go. So we've talked about peripheral arterial disease, the symptoms, which are the things you feel, the signs, which are the things your healthcare professional are going to find on examination, the investigations that you kindly brought up, and then the treatment options, which, of course, always start with a lifestyle modification, plus maybe some of the other things, medications, minimally invasive procedures, or full-blown open surgery.
Correct.
Wow, good summary. If you have any experience with peripheral artery disease or limb ischemia, please leave a comment. Share your experience, what has worked for you, for the lots of other people who are suffering from this problem right now. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health. Thank you so much, Dr. Chan.
Oh, you're welcome.
See you next time.